The early days were really funny because I remember I would like write letters. You remember you had a typewriter and you'd write letters and you'd send letters in the mail. So I'd write to Johnson and Johnson and ask them for medical supplies to go help a children's hospital that I was supporting in Cambodia while training, mine action deminers, as part of a broader program. So it was very, very small. And then all of a sudden I'd get a few boxes of medical supplies and I'd have to keep them in my apartment. And that's the humble beginnings of where we were. And I think back to what we started doing, in 2002, I led a team over and we had given medical equipment to this children's hospital, whether it was everything from, hospital beds to medical supplies and stuff that was still new. And that we just take for granted in our system, but stuff that, when you're coming out of, post-coup, post-genocide Cambodia, where you have like one doctor for like 80,000 people, and no pediatric doctors and no pediatric hospitals, and then you've got the Angkor Hospital for children being set up and running, like you had to get them equipment, you had to get them help. So to fill up containers with equipment that they could use. And then I remember the very first time I did this, having absolutely no knowledge of this world or the system, collecting all that equipment, sending it over, going to Cambodia myself, going to the port, thinking that I could walk into the port and somehow collect my container, like the ridiculousness of that thought, having to find a local broker, clearing it, going into the minister's office and sitting there for hours being an absolute pest until he signed the clearance documents for me just to get me out of his office, which was, probably not the greatest way to do it, but it was certainly a way to learn and understand about bureaucracies. And on a very funny note, we just sent aid to Cambodia a few months ago in masks. And the person who signed off my agreement, I looked it up, is now the same person 20 odd years later who's in charge of all NGO programs for that Ministry of Health. And I remember him, being a little harsh with me and throwing me out of his office with signature in hand, and then laughing at me the year later when I came back in with another container and saying, "Didn't I tell you?" So, and then going down to the port with the customs broker and saying, no, I want to watch it get cleared. I put my whole life into this and collecting this equipment. I want to make sure it gets to the hospital, as if somehow I could prevent it from getting to the hospital or stop anyone from taking it. And then accompanying that container in a truck for days, sometimes sitting on the can, sometimes, just sitting in the truck as it meandered up the road from Sihanoukville, it's Kampong Som, which is the port town, through really bad roads. You can just imagine. Cambodia, 2 million killed out of a population of 7 million. The Khmer Rouge, the genocide was horrible. The country was starting to rebuild. You could live on like $4 a day, $3 a day in that country. Like it was insane how cheap everything was and how nothing was built up. And then I remember arguing about paying a $77 unloading fee to take the can out of the boat into the yard and then onto our truck, and then just sitting with that truck for days, coming up through the capital all the way up to Siem Reap just to get it to the hospital. And then when it arrived in the hospital, having the staff come out and unpack it with them and going through and seeing what was useful. And unfortunately, some of the stuff wasn't as useful. So the stuff that wasn't as useful to the pediatric side would go to the regular hospital. And then at the same time meeting, the mine action folks. So these are people that were tasked with clearing landmines. And because Cambodia you couldn't restart life, right? Like, how's a farmer going to toil their field? How are you going to build a school if there's landmines everywhere? And one of the horrors of this war was they put landmines everywhere. And of course, they didn't take them up and they didn't remove them and they didn't even map them. So people didn't know where they were. And it, to the point where, even as a tourist to the country, like you were afraid to walk off the main road because you're like, what if I step on a mine, And then meeting those teams, I would say, well, how can we help you as well? And then creating this program where I would come back with other folks like myself, paramedics, who dealt with trauma every day, and come back and train and instruct people that were going to work as medics alongside the landmine teams, because you can't have the landmine team go and try to remove mines or blow them in place unless you had medical support. And in a country that didn't have enough doctors or medical staff, how are you going to pull that medical staff to go and work, mine action. They didn't have paramedics. They didn't, it was just coming out of, literally, it was the early 90s, right? They were just coming out of, war and this genocide, and, it just wasn't working well. And by the mid 90s, when I was there, we decided, hey, look, we're going to help and we're going to train you. So I'd go over on my own every now and then, just kind of figure it out, do some training. And then in the early 2000s, when we started the agency, and we got charitable status in 2002, and we're filling these containers. And then, I managed to convince about 10 of my colleagues from the paramedic service here in Toronto to come with me, or take their vacation time, pay their own way. Let's go over. And we went to different areas and we trained medics to go out and be with these landmine teams. It was a very interesting operation. And then, everybody went their own way. They ended up down in that beach town, and they just kind of went on vacations. But they'd given back a couple weeks of their time, really out in rural, rough areas that were very underdeveloped, just to try and get those medics trained and get those medics deployed, so the mine action teams could remove the explosive remnants of war, so society could start again. And now here we are 20 years later, and you see how Cambodia has changed and developed, and none of that happens without those medics.